Let's give a warm welcome to Dr. Shrilata. Shrilata, it's truly a pleasure to have you with us today, and we're eager to hear some insights from you and have a meaningful discussion on this topic. I know you have something to share over with us. I'll hand over to you for now.
Thank you, Radha. Definitely. As we women should exchange our thoughts, exchange our health issues, we have to discuss on that. That is a prior importance today. So today I'll be discussing on women's well-being through Ayurveda and yoga. First of all, let us see what is well-being. Is it just having normal values in your blood report, or is it something like having normal features in your USG scan? No, it is beyond that. In Ayurveda, what is health? What they tell about the well-being? It is mentioned that samadosha samagnischa samadhatu malakriyaha prasanna atma indriya manaha swastam ityabhidhiyate. That means when your doshas, whatever Mahima mentioned, that vata, pitta, kapha doshas, when they are in the balanced state, when your tissues are properly nurtured or nourished, when your all the excretion is taking place properly, when your indriyas, that means all your sensory organs, when your mind is in a good state, then only a person is called as healthy or the swastha. So here we are concentrating on women's health. Why? So you all know that in the past, or like if you go back to the 3, 4 decades back, women were primarily concentrating or looking after the household things, and the men were going out and work. But now the things have changed. Women have become multitaskers. She's balancing many roles in her life, like mother, as a mother-in-law, as a daughter-in-law. She is facing or she is handling the pregnancy, she is handling the postpartum, the delivery, raising the kids, working as an employee, working as a CEO, working as an MD, what not. She's excelling in her professional career too. But if you see many women, they're doing everything perfectly, but when we ask about their health, oh, sorry, I don't have time for this. I don't have time for exercise. I don't have time to make some nutritious food and eat. So many women balancing the work, family, personal health. For many women, it is overwhelming, and many times they compromise with their personal health or personal health care. They should not do so. Why? Because she balances various roles externally while navigating different phases internally. What is this different phases? If you see Ayurvedic reference in the Sushruta Samhita is a textbook where it is mentioned a human body, especially if you talk about the man, a man has 11 srotasas. Srotasas means different channels or the pathways where the nutrients or the energy, prana or the respiration, all those takes place. It's a path. So man has these 11 pairs of srotas for the proper functioning of his body. But what about women? She has two extra pairs of srotasas. They are to give birth to the new life, to nourish the new life. That is the uniqueness of women. So she has Artava srotas that is connected with the reproductive system, the uterus, ovary, ovum, all those things, and the Stanyava srotas that is related with the production and secretion of milk. And also, if you see a woman from the birth, her the life has a 7 segments when you consider the hormone. So once she is born, from there, when she goes to or when she attains the puberty, that's around like 10 plus years, there will be hormonal changes taking place, and she will be attaining the menarche. Menarche means the first menstrual flow. So there's so much hormonal changes, so much physical changes. Currently, we can see many girls, they attain this puberty like before 8 or before 10 years. What happens? Their body is maturing before their mind matures to understand what is happening in them. Still, whatever their roles are there in the external world, they will do it. Next comes the reproductive years. That's like 20 plus year. Hormones will be in the peak. Education, her work, all those external things also will be in the peak. She will be like she will be in the state of pregnancy, the carrying the child within her, and then delivery, postpartum body changes. The girl who always wanted a lean body, flat tummy, she may have that mummy tummy, skin changes, sagging, all those will happen. But she balances, she maintains all her responsibilities properly. Once the reproductive age continue proceeds, then comes to the premenopause or the perimenopausal, all those periods. What happens there? The hormones slowly depleting. She faces certain changes, hormonal changes, and also the mental changes, the irritations, hot flashes, stress, the bodily changes, maybe weight gain, all those are seen. Still, she never forget to complete her external responsibilities. Then comes the menopause. There so much changes happens, her body weight gain start in many people, we see many women, there will be weight gain issues, they complain about the hot flushes, they can't bear this crowd, they can't balance so many things happening around them, the multitasking capacity may vary. Still, whatever happening internally externally, they do all those works. Once this menopause is finished, when they enter into the post-menopausal period, many times women think, oh, now no more periods, happy. Wait, there will be hormonal depletion like anything, and along with that, your bodily changes, your calcium deficiency, calcium goes on declining. That leads to the decrease in the bone density. The calcium depletion leads to the like it leads to osteoporosis, all those joint issues, pain, all such things. So, see, in her whole life, she faces so many fluctuations in her hormones that leads to her physical, mental changes. Still, she is never forgetting her responsibilities. She does all her responsibilities to the point. Still, she's not prioritizing her health. How far it is right? So, why it's happening so? Many women come to a clinic and they say like I have sleeplessness issue, I'm gaining weight, my periods are not regular. When I say them, first you have your food properly. What time you are having your breakfast? What time having you are having your food? I mean your lunch. All those they say like, doc, I don't have time, so I'm having my breakfast at 11 o'clock, 12 o'clock, or sometimes I skip my breakfast. These are the reasons that are leading to the hormonal imbalances in them. When I when they are oversized, and I ask them to do some exercise, do some yoga, they say, no time, doc. I can't do exercise all those regularly. Ladies, please just take 2 minutes out of your 1 hour, 2 into 24, just 48 minutes of 24 hours. Keep it for you. Work on yourself. And many girls, you can see the adolescent or these teenage girls, they attracted towards the processed, preserved, this frozen food, fried, imbalance your hormones, the sex hormones. In many girls, the early puberty may take place. In many girls, there will be issues with the PCOS, issues with the thyroid, the weight gain, the skin changes, hair fall, so many issues. And also, I think you have seen many ladies saying that once they are going to office, they use a washroom at home, and in the evening when they are back, then only they are using the washroom. No urination, not using any outside washrooms. What happens? There will be infection, the urinary tract infection, vaginal infections, the renal calculi. So many things are happening. Rising stress levels, mental strain. So initially you feel like, oh, nothing is happening, but on the long run, you may face PCOS, thyroid issues, obesity, stress, anxiety, skin issues like hyperpigmentation, that is change in the skin pigmentation, skin texture, dryness, or hair fall issues, unwanted hair growth on your body parts or on your face, the facial hair growth, hair fall from your scalp, and gynecological issues like even the fibroids, irregular, or the periods that don't take place properly every month. All these issues can take place. And if you still neglect, The one issue can cause multiple issues. See, like PCOS. So if you go on neglecting, that may lead to the diabetes, that may lead to the obesity, that may lead to the thyroid issues, skin issues, stress, anxiety, so many. So you should always take care of your health.
Thank you so much for that insightful presentation, Doctor. It was really something which we know already, but you have given us more in detail. That's Thank you so much for that. And we'll start off with some questions about like hormonal imbalances. You
Mhm.
said like there are hormonal changes during the PPTs that you presented, like PCOS and thyroid disorders. They are all interconnected, and most often these disorders affect much more than just periods or weight fluctuations. They impact energy levels, emotional well-being, and sometimes even I think relationships. Could you share how these imbalances affect women's overall health and what strategies can help in managing them effectively?
Yeah, Radha, you are correct. So these things are like affecting women like anything, not just the external look, like it may affect physically, it may affect mentally, and even it may affect socially also. So you asked about the energy levels. See what happens in all these hormonal issues, like if you take about the PCOS or the obesity or thyroid issues, your metabolism decreases. That means in Ayurveda we say pitta. The pitta is responsible for proper digestion, proper production of all the necessary secretions, the hormones, everything. When your metabolism decreases, there is no proper digestion. The digestion is not just what we eat, the digestion is at the level of tissues also. So when that is not happening, your energy levels drop, there is no energy production. Second thing is you can very commonly see in this PCOS or the thyroid issues there will be fatigue. That means without any extra work, the woman feels tired. Those who are suffering from PCOS or the thyroid issues, they feel tired. So by all these things, the energy drops. And also in PCOS, we can see insulin resistance. So what is this insulin resistance? Generally, in our body, there will be insulin production from the pancreas, and that is utilized by the body for the conversion of sugar, like whatever we take, right? Sugar that gets converted. So in insulin resistance, what happens? The insulin is produced, the sugar is in the blood, still that insulin is not utilized, body is not recognizing. So there is no energy production, again the depletion. So all these factors like fatigue, metabolism which has reduced, and also insulin resistance, all this leads to the depletion of energy. And also there will be sleep disturbances take place that affects our body. The weight gain will be there, the drowsy look will be there, the skin dryness, thickening of the skin. If you see in the PCOS, all those, there will be darkening of the nape of the neck. It becomes very dark. And even on the face also, acne formation will be there, hyperpigmentation, the dark spots we can see in some women because of these hormonal issues. All this affect her physically. And again, mentally also, these hormonal fluctuations, they have effect like the stress, irritability. They can't manage so many things when there is like when there are multiple things or tasks to complete. They will not be in the position to complete it. They get stressed. Oh, I can't do so much work. That thing will be there. And if you see social, how social life gets affected or how social well-being gets affected. See, many they feel like they gaining weight. This dress is not fitting. I'm losing hair. My skin is not looking good. I can't go out. I can't mingle with the friends. I can't socialize. All those leads them to keep themselves away from the people. So all these are the effect of the hormonal imbalance and we neglecting the hormonal imbalance. So how you can manage this? Very simple. First, the remedy lies in you. You are your first caregiver and your kitchen is your first clinic. First, understand your body. What are the changes happening in you. I know you are doing so many works, multitasking, still have some time for yourself. Understand your body. Are you gaining weight? Are you losing hair? Is your diet proper or no? What is the changes? Are you eating outside regularly? Are you eating so much of processed foods outside? So check, list all those. So accordingly, you can plan, balance your diet, have some healthy diets, fruits, vegetables. One, the great technique or the great treatment in Ayurveda is detox treatments, panchakarma therapies. They help to cleanse your whole body, including your uterus, your thyroid gland. So, go to your Ayurvedic doctor, undergo all these treatments, and practice yoga, pranayama. All these help you in a greater extent to come out of this.
Uh, Thank you so much for that, Shrilata. I have a connecting question to this. So, as you said rightly, that whatever we eat, that defines us, right? So that depends upon the time also, the time that we are eating, what time we eat, and what time we choose not to eat. Can you explain a bit about it?
Exactly. That is really important. I'll show you this. Okay, see, what we eat is definitely important. Along with that, where we eat, how we eat, what proportion we eat, what time we eat, everything is important. See here, it is mentioned eat fresh vegetables and fruits, eat fiber rich diet. Along with that, also mention eat mindfully. Whatever you are eating, your concentration should be on the eating. When you are working, your concentration should be on the work, right? The same way you eat, when you are eating, your concentration should be on the eating. Then the absorption also improves, the metabolism also improves. For whatever food we take, that's digestion depends on whatever the juices that are supposed to be produced in our stomach, right? For that release, our brain has a like a switch. The switch is here. So whenever I eat mindfully, when you're concentrating on the food, the switch here, the switch on, and the secretions take place, the digestion takes place. And also here I have mentioned yama madhya na bhunjaye dvayami na langaye. That means yama means 3 hours. Okay, in the Sanskrit it is mentioned in Ayurveda. Within 3 hours, you should not go for the second meal. Okay, what happens for the proper digestion of the food? At least 3 hours required, and dvayama na langaye. That means if it is more than two yama, then more than 6 hours. Still, if you are keeping yourself hungry, that is wrong. That may lead to the acidity issues, all those. And also, it is mentioned naktam dadi na bunjita. You tell me how many don't eat curd in the night, but actually that is really wrong because when you take dhati, I mean curd in the night, that vitiates increases your kapha dosha. The kapha which is vitiated will be responsible for indigestion issues and also weight gain issues. The unhealthy kapha accumulation takes place. That's why we have to follow what to eat, when to eat, how to eat, what quantity you should take. All those should be kept in the mind.
Wonderful, Srilata. So, building on that, one of the biggest concerns women face with PCOS or thyroid disorders is fertility challenges, whether it is difficulty in conception or pregnancy complications or conditions like fibroids. With many patients you see daily on regular basis, how do hormonal imbalances impact fertility and childbearing? All around me, I see more and more women turning to IVF these days as an option. What does Ayurveda have as advice here in this particular?
Oh, that's really very good question and very useful question. See, if you see before like 20 years back, how many IVF centers were there and how many are there now? It's all mainly because of our food. Whatever we eat, that we reflect from our body. So, what happens in this hormonal imbalances, like whatever food, unhealthy or untimely food we take, what it results? It results in hormonal imbalances. When you come to the fertility part, so how the fertility takes place or how like for that, initially we need sperm and the ovum. Sperm is from the male and ovum or the egg is from the female. So in the women, the egg production takes place at particular time and it comes at the ovulation time, the middle of the cycle. That time it will be ready for the conception or the zygote formation. What happens in the PCOS? Sometimes there will be production of the egg or the egg as there is a PCOS, polycystic ovarian syndrome. So as there is a cyst is closing the egg, it is not able to come out. So when it has not come at the proper time, ready, but not completely. It comes out, but it is not mature. At that time also, there is no fertility chances. So these are the major causes, or like to say hormonally, these are the things that are responsible for infertility issues. Along with that, insulin resistance, all those are leading to the miscarriages. Like the women will be pregnant, uh, everything goes well for like 2 to 3 months or the initial part of the pregnancy, and then there will be miscarriages, abortions. Why it is so? The hormonal fluctuations, the insulin resistance, the sugar level increasing like crazy. The female may have gestational diabetes, though she has conceived, there will be gestational diabetes things, preeclampsia or the BP issues will be there. There will be chances of premature delivery also. There will be, along with the baby, there will be formation of fibroid also within her. So these are all the like can take place because of this hormonal fluctuations. There may be chances of pregnancy. There may not be the chances of pregnancy because of this. When the pregnancy takes place, then the course of pregnancy, the woman may face all these issues: miscarriages, abortions, diabetes, all those things may come. So in such cases, the first and foremost thing I would recommend, go for the detox. That's Ayurvedic detox or the Panchakarma procedures. As I already mentioned, that helps to cleanse whole body, cleanse the ovaries, cleanse the uterus. So the complete path is like very clear, free from any what to say, any destructive things. The hormones will be in the balanced state. Still, if the woman is finding difficult, she is choosing for the IVF, there will be externally hormonal injections. All those are given to improve the quality of the ovum or to improve the size. All those things will be there. Along with that, or before doing that, if you undergo all these detox treatments, some herbal remedies. In Ayurveda, we have Shatavari, Ashwagandha. There are many medicines, many herbs. Consult your doctor, your Ayurvedic doctor, and go for all those cleansing procedure first, and then go to the IVF. The success rate will be very high. So you choose detox first. If IVF is really necessary for you, then after that go for the IVS. You will really see the success rate.
I think our audience is really going to appreciate this because you clearly said that IVF may be an option, but before taking as IVF as an option, think about few other factors that can improve your
Certainly.
health. If nothing is working, then you have to go to IVF.
Even like those who are undergoing IVF or those who are planning they will for IVF, the women have so much stress. The stress also impact the fertility later. So to relieve all those, along with this detox procedures, regular practice of pranayama, yoga, that helps a lot.
So, something that I want to go back to your slides that stood up really well, which is the impact of modern lifestyle on women's hormonal health. It's interesting because some of the women develop PCOS despite leading a healthy lifestyle. I have seen some of my friends, while others see improvement just by making lifestyle changes. What are the real underlying causes of hormonal imbalances, and when it comes to managing them, how actually it works?
So the reasons for PCOS or the thyroid issues are like not single reason. It has multiple reasons. It may be genetic, maybe mother may be having the PCOS issue or some such sex hormonal issues, or there may be gene mutation taking place, autoimmune like insulin resistance, as I already mentioned, like in the PCOS, there will be insulin resistance. That may be there is a one reason. The second is the faulty or the lifestyle that is like not sleeping in the night time because of the work, because of the shifts, or because of the new mother who can't or who finds it difficult to manage the night sleeps. That may be the reason. Or many taking the food that is really not good for their body. These processed foods, preserved foods, or these frozen foods, daily taking fried items. All these are the different reasons. Or maybe just if she's all fine, but a continuous stress in the office or at the home. From the stress, also her hormonal fluctuations may take place. That also lead to all these PCOS or the thyroid issues. So, what is the reason for uh, PCOS in this woman may not be the reason for this woman. That's why for some people, just by exercise, just by some yoga, or for some women, just by some diet, they bounce back to the normal, like all they're healthy, they will be healthy. But some, when it is gene, when there are multiple reasons, it really takes some time. They need some assistance from the doctors or some health givers, some exercises, yoga, diet plannings, management of the stress. All these things they should look into.
Let's hear from our audience. Have you come across conflicting advices on managing PCOS and thyroid conditions? And if so, drop a comment and let us know. And speaking of conflicting advices, thanks to our WhatsApp university, half of the world has become self proclaimed doctors. There's so much information that's floating around about these hormonal changes, and especially when it comes to hair, acne, and skin health. Doctor, if you remember during one of our conversations that we had very recently, I was talking to you about these messages that confused me. Should women with hormonal issues oil their hair or avoid it? If yes, right? Yeah. Amid these conditions, what do you suggest as the most effective and natural care for skin as well as hair?
That is again your clinic, your kitchen. So first thing is eat healthy, stay healthy, follow healthy lifestyle. Everything will be fine. I have seen actually a few months back, I had been to one salon for the haircut. There, that salon guy was telling to a person, don't use oil that tans your skin. See, how come actually applying, and also he was telling that, what to say, that leads to that may cause damage to your hair. How come a oil that was used for thousands of years, actually our grandparents had black like dark thick hair when they were like 70, 80 also, right? If you see now generation is like 25, 30, we can see that salt and pepper hairstyle. So why it is so? They were using hair oil regularly, they were using like massaging the hair with the oil, and then they were exposing the hair to sun. That leads to the production of melanocytes, the melanin production, that improves the darkness or the dark hair. But I'll tell you one thing, here's one logic in that. This hair oil, whatever you apply to the hair, that doesn't cause tan on your face. But when you apply the coconut oil on your face and you go out, again that melanocyte melanin production increases. That may lead to the more melanin production darkness, but it is not tan. So for everyone, I say at least twice in a week, apply hair oil, massage your hair properly so that the blood circulation improves. You'll definitely get good hair, thick hair, dark hair. And those who have this PCOS, thyroid issues also, along with the internal corrections, the hormonal corrections, if you apply oil to your hair regularly, any hair oil that you are practicing, like maybe coconut oil or the mix some medicated oil or the sesame oil, all these are very good for your hair. And when you come to the skin, first thing is wash your skin or wash your face properly with a simple water, like a normal water is enough, or you can wash it with the this scrubbing like rice flour, that works. And after that you can cleanse your skin with this all exactly from your kitchen only, turmeric or the tomato or the combination of the orange peels or the amla, or we say this licorice, all these are very good for your skin. Just try all these techniques regularly, even the aloe vera, and you will have a glowing skin, beautiful hair.
So I recently heard someone saying, I don't know whether it's true or not. I want to hear it from you, doctor. Is what you cannot eat, you cannot apply, or that's something I heard. Is that right?
Sorry, I
Which
didn't get.
cannot, what you cannot. I mean, when you intake something, only those products must be applied over your skin. So is that correct, to an extent at least?
No, not all the time. We mentioned, right, some things for only for the external use, something for the internal. Whatever we eat internal, we can apply external, but it depends. It's not always.
Okay. That's really fantastic, and thank you for clearing that. Because, as I said, thanks to these WhatsApp messages that we come regularly, so that's one of the messages that I read recently. And
Rather, the first thing
yeah,
is don't follow Google doctors, don't follow WhatsApp doctor. That is the first management you should add.
so yeah, so we should know what to do and what not to do, and trust doctors for that. Very nice. And here there is one more thing that I have been recently going through. Like whenever I go for walk, I keep hearing women, for say they can be young or older. I see everyone talking about stress. And it's a common struggle we see daily. And we know that stress directly impacts hormonal balance. Beyond that, hormonal health is not just a personal issue. I think it affects focus, energy level, and even work efficiency. So, how does this PCOS impact our daily productivity? And if so, first, suppose for somebody who is working in their professional lives, if they are facing any challenges, how can women manage these challenges?
Correct, you are right. Like from the very young age to the very old age, we hear this word stress. It's like a very common word. Yeah, as we discussed earlier, all this PCOS and the thyroid or other hormonal issues, there will be imbalance of the hormones. These hormones are responsible for the our like mind activities also, or our brain activities also. So what happens, as we discussed, without any activity, it leads to the fatigue or the tiredness. The energy dropping takes place, and also, as I already mentioned, these hormonal issues are connected with the kapha dosha, the vitiation of the kapha dosha and the vata, and metabolism is decreasing by decrease in the pitta dosha. So, as we always say, Agni dosha hi manushanam roga sankhya pratakvita. Agni dosha means Agni means the digestive fire or the metabolism. If metabolism is like going down, or it's in the worst condition, that leads to the n number of diseases. So this is the first culprit. So the metabolism is when very poor, improve the metabolism first. That helps to solve the 50% of the issues. And also the all this insulin resistance, all this, how we can bring it to the normalcy by regular exercises, by regular yoga, pranayama. Pranayama can help you a lot in bringing your stress down. It helps to keep your mind refreshed. Refreshed mind can be attained by regular practice of pranayama. Just spend 20 minutes in your whole day. Or I can say just 20 minutes in 24 hours. That helps to keep you healthy, keep you relaxed, and you will be able to balance many more functions, like a literal multitasker you will be. So what happens when the stress increases? The brain fogging takes place. A woman may not be able to concentrate on the different tasks, or that cognitive function reduces, or she there will be deadline for here, deadline for this work. She may not be in the position to balance this when there is stress. So when you practice all this healthy, the balanced diet, balanced lifestyle, good sleep, 7 to 8 hours of good sleep is very much important. When you do all this, definitely it helps to bring down your stress.
Thank you so much for that. That's a great takeaway. I hope everyone made a note of all the points that Dr. Shrilata is mentioning here. And last week, if you remember, we spoke about one of your patient who was experiencing severe hair loss, only to later discover it was due to thyroid condition. There's so much misinformation out there, like myths that thyroid disorder causes only weight gain, when the reality they can also lead to fatigue, depression, and even hair loss. One of the myths that I have communicated just now is about what we eat only we can apply. So there are many things that's going on, doctor. So what are the other common misconceptions you come across on a daily basis around hormonal disorders? And how can a women educate themselves to separate fact from fiction?
Okay. Yeah, many times we fail to take test or we fail to understand ourselves, and only we see the symptoms. Okay, there is hair fall, just put on some oil and it will get corrected. But we don't have time or we don't make time for ourselves to understand what is happening internally. Actually, such like how to say, such myths are there with so many things. One very interesting thing I'll say, like maybe you may feel like out of this topic, but something connected. My own experience, quite a few years back, one of my junior brought some pomegranates from his farm. They were very beautiful, very nice. They were like so red in color, and he asked me to take some. In that also, I chose some big, some red, beautiful pomegranates. And then he told me, "Oh, ma'am, you chose these pomegranates because they are very beautiful, very nice, very tasty, right?" Then, yeah, yes, I do. Then he told, if you get anyway these kind of pomegranates, that means they are treated with pesticides from the day one, from the flowering time. They will spray from the flowering time till it is dispatched to the market. So something that looks colorful is not really always good. Okay. So every glittering things are not gold always, right? The same way. So we have to analyze the things. We have to actually fruits. Go for the local fruits, local vegetables, which is grown in your area. The geographical area matters a lot. We say desha, kala, all this with respect to food intake also. So see all those, consider that, understand that. Then you will understand reality, which is good for you, which is not good for you. Don't go behind the advertisements, whatever is seen. So many they say it's a organic product, it's a organic shampoo, it has completely organic. Just go and see the ingredients list. Many times you will see 0.0001% of herbs in it.
Yeah, this one recently I have observed while the discussion that we had earlier, you were quoting the same thing, and I really observed it. And even on the herbal products that are advertised, I observed that the percentage of the herbal nature or the ingredients that are added is very less. So, to the audience, I think we should first check the ingredients and what's the percentage of the every item is added in that. We can go ahead and then we start using them. And we have a couple of questions from the audience, Shrilata. I'll take a few. What is the ideal dinacharya?
Okay, so let me share. Okay, so first of all, what is dinacharya? Dinacharya means daily regimen. What we have to do in the morning, what we have to do after that, after that, after that. And why we have to do is also equally important. Let me explain that. So it's mentioned like it helps to improve your physical, mental, spiritual well-being. First, you have to wake up in the Brahma Muhurta. Brahma Muhurta means it's generally like 48 minutes before the sunrise. It is considered as Brahma Muhurta. Why you should wake up in Brahma Muhurta and do some good activities like studying or something that is required for your mind. such things or some knowledge things, some important things we should do in these hours, because there will be good amount of oxygen in your surrounding during the Brahma Muhurta or during that period. So that helps to improve your brain capacity, that helps to improve your grasping powers, all those. And also, I'll tell you one more important thing. I think you have heard for some women, they said those who are struggling for the conceiving, they get advice like take around the people tree in the morning, do puja, all those. There is also some scientific reason behind that. You know what? This people tree can release more amount of oxygen compared to other plants. That's why it is said to take the round around. Like in our spiritual context, also they have mentioned all, but we fail to understand the reasons. But there are reasons. So they improve oxygen level. When the oxygen levels are increased, our tissues get good amount of oxygen, good amount of blood. So that helps for the fertility. So the day should be started with waking up in the Brahma Muhurta, then drinking handful quantity of warm water. We have seen many people mentioning, I'll take 1 liter of water in the morning, and some people they don't drink. But it is ideal to take just handful. This is like just handful of warm water that helps to cleanse your gut. So after that, all those completing your nature calls, teeth brushing, tongue scraping, all those are the part of the dinacharya. After that comes the oil pulling. So oil pulling, we call it as gandosha. If you have sensitive teeth, this is the good remedy you can take. Just gargle your mouth with the oil, like oil regularly, maybe sesame oil, coconut oil. That helps to stop the sensitivity. Then comes the abhyanga. Abhyanga means oil massage. So oil massage helps to keep your skin healthy, and at the same time it keeps your stress away. Actually, that has a connection with your brain, that has connection with your stress level releasing also. So massaging, if you go to the spa, if you take massage, you feel better, right? In the same way, when you practice it daily, it keeps your body also healthy, it keeps your mind also healthy. And then comes exercise, yoga, pranayama, whatever you like, you practice, but keep pranayama along with exercise or the yoga, because that helps to keep your body fit, keep your mind fit. Then taking bath, timely intake of the food, breakfast, lunch, dinner at proper intervals, not too late dinners. So what happens? Your body needs certain time to digest. So when you take food very late, you have no time, you are not giving time for your stomach to do all those activities. So have early dinner, have timely dinner, have timely food intake. So these are the simple, whatever you do it with some proper schedule. That makes your dinacharya the best. That helps to keep yourself healthy and happy.
So, in summing up all the things that you have told till now, like we have to wake up early, we have to take care of ourselves. As a woman, we need to give some time for ourselves, our health, and we eat mindful, consciously eat some good food and some rest along with some meditation if possible, and yoga as the dinacharya process. If possible, there is some oil pulling or other things, uh, and something that you also mentioned is to take care of your body and be happy. So, and I'm so happy you shared us so many insights today. And we have a question from Swapna here, Shrilata. So, can you share resources from where we learn these basics of health?
Everything is there in your daily life. Everything your mom has, everything how you can keep yourself healthy. Our Ayurveda has everything. All those are simple. It's something like it's there around us. We should see it. We should understand it. We should pick this.
Okay. Thank you for that. And we have next question. Can I take it?
Yes.
Yes. So now Manisha asks, is it harmful to have methi seed water on regular basis to control diabetes
Methi seed water.
in the morning?
Okay, okay. That is really helpful. You can do that. Methi seed helps to like improve that insulin function. It helps the insulin function, the pancreas work. So you can have it daily, no problem.
Okay. We have our next question from Miss Chandana. Dhania water early in the morning on empty stomach help relieve thyroid for some level.
Actually, Is that a question or her experience? Sorry.
It's a question.
Okay. Actually, dhania is helpful to cool your body. That helps to reduce body heat. If you see practically in thyroid issues, or to say hypothyroidism, that is what we see very regularly, right? The hypothyroidism, where there'll be weight gain, uh, bradycardia, slow heart movements, all those will be there. In such cases, more than the dhania water, go for something that improves your digestion, improves your metabolism. Just use all this ginger, garlic, turmeric, jeera, such spices, the Indian spices in your cooking, like a cinnamon and all, that helps to improve the metabolism. Once the metabolism is increased, that helps to activate your thyroid gland. So that TSH, all those gradually comes to the normalcy. Also, one more thing is in thyroid issues, like along with the stimulating the thyroid, working on your liver is also equally important. Liver is like a power of house of our body. We have to stimulate the liver to cleanse our body, or the detox. Once you detox your liver, that takes care of your whole body.
So coming to that point, I have a quick question on that, doctor. Is this right now? I'm hearing a lot about grade one liver. So this is this reversible?
Definitely, if you change your lifestyle, if you change your food habits, definitely.
I have
Just
one more question. Huh?
Mhm.
Please.
Sorry. See, all the time you don't need medicines. Just your home remedies are enough. Or like the bitter is actually butter for your body. You know. So like neem, or something like methi. All these are very good. They help to activate your liver. So all those fatty liver grade one, that can come back to the normalcy easily.
Fantastic answer. Thank you so much for that. And we have one more last question from one of our audience. So, Ayurvedic medicines or remedies are known to be time taking. How to deal with the prolonged remedial timelines when one would actually require a faster solution to their health?
Okay.
That's a genuine question, I
So,
believe.
yeah. So if you are talking from this hormonal perspective or from the today's concept, I'll tell you, if you have a hypothyroidism issue, you cannot solve it in a day. But if you follow proper diet, if you improve your metabolism with some, there are some kitchen things also, there are some medicines also. I'll tell you, within 45 days, your TSH levels almost come back to the, or come to the normal range. I have seen many patients. And important thing is, I have seen many patients who are fresh to this hypothyroidism issue. They have not taken any other medicines, any other hormonal infusions, the hormonal supplements. I have seen in them the thyroid levels coming to the normalcy within 45 days, or decreasing, that higher level coming down. So, what is happening in Ayurveda? We are not, if you take the hypothyroidism issue, we are not giving you thyroid hormone. We are stimulating your thyroid gland. We are stimulating your brain to produce the hormones. So, it takes almost like 45 days, definitely. Like I see many patients, that's why I'm telling this number also. So that helps to stimulate your different organs connected to the thyroid secretions, and your levels, the thyroid level come to the like a normal range, or to the that range.
So there are more questions that are pouring in. I'm so glad our program is really helpful for most of the women here. So Shilpi asked us this question: can you share how our face issues represent our health issues, like acne, pimple, pigmentation, etc.?
Okay. So this acne may happen because of the that adolescence, that puberty age also, that you can differentiate from the hormonal diseases. Like in the that adult age or that adolescent age, that is also because of the hormones, but they are in the normal range. Maybe they are fluctuating here and there, but in this disease, they are like they are going beyond the normal range. What happens in that case is the acne that is not going off. Like usually, what happens when there is a ovulation period, there will be acne formation, or for some, when there is a menstruation, there is a acne formation. But in this case, Continuously, the acne will be there whole 28 days, 38 days cycle. The acne will be there continuously. Second thing is skin changes. The thickness of the skin, especially you see, right? In the that's what again the neck portion or this elbow portions, there will be thickening of the skin will be there. The hyperpigmentation, the dark spotlight. Usually, the skin will be even, but in these hormonal diseases, the skin color will be changed, the hyperpigmented here and there you see dark spots, the uneven spots. And also some women you see this butterfly like rashes, the hormonal variations leading to that. All these are because of the hormones. Other than this, just a pimple coming and going because of the periods is normal.
We're talking about this black rashes some people have. So it's not because of the worms or something. I recently read one news. It's because of the hormonal imbalance itself, right?
Correct, many a times it is because of the hormonal imbalance.
So we will definitely get checked before coming to a conclusion to with the doctor. And we have two more questions here. Aditi asked us that what would be the red flags we should look for in popular marketing of Ayurvedic and herbal products? Just now we discussed about the ingredients. So yes, doctor.
Okay. If you go for the products, you have to see the research works. You have to see how many research works are done. What is the real conclusions, real discussions they have mentioned. But before that, as much as possible, use whatever you know, whatever is there with you in your surrounding. Local for the local works here also. That gives you the right product. You can use the right products. For example, if you see just the like face masks or whatever the face packs, make it home. It hardly takes 5-10 minutes. Make it, apply it, whatever work you have, do it. So that works.
The last question would be, can you elaborate little on how to deal with fatty liver issues? As you mentioned, it can be reversed early stages at least. So what precautions or process should we follow for it?
Mainly diet. So what happens in the fatty liver? Usually, if you see the people or the patients, one is the inflammation, that is something different, will leave. The second is the diet, regularly taking fried items, regularly taking processed items, and maida, the refined flour. Many young adults are attracted towards pizza, burger, all those. Once in a while, yeah, it's fine because we are not out from this world, we are the part of this world. So once in a while, it is fine. But if you go on taking it regularly, there is no fiber in it. It's only the sugar. What happens? It goes on accumulating in your body, the body fat, the liver fat, everything increases leads to the fatty liver. So just avoid that. You, if anybody is having this fatty liver issue, grade one or initial stages, you just try with the exercise, try with the diet. That works very best. Actually, you can try it.
Uh, Wonderful insights, Doctor. Today, I am like so happy to have you here, and I'm sure our audiences and attendees gained very practical understanding on how our ancient wisdom from Yoga Sutra and Ayurveda. Uh, the, the eye opener was that all hormonal imbalances in women's body is interconnected. And the Nadi Sutra helps balancing and managing them only via food intake, peaceful mind, and body sync. So, and the activities without any external and chemical interventions. And there are so many more discussions I'll be keen to engage in, but unfortunately, we are at the crunch of the time. And for today, we leave with pearls of wisdom of mindful wellness with our food, activities, and information that was that we consume. I would call back Mahima.
And also, I have to mention, thank you, Radha. Actually, I'm happy that as a part of this discussion, and I could help my surrounding, my people. I'm glad, but I'm happy if they take all this information, they follow.
Thank you so much, Dr. Shrilata and Radha, for engaging in such a insightful conversation today. And the crux, what I could understand with the entire conversation, that uh, 80 to 90% of the problems in health or holistic mental well-being a woman goes through is all related by their hormones. And women hormones are so much different to men hormones, and that is where the complete unstructure and imbalance of understanding of inclusion of women's side of conversation or women's side of health is still not in action, not in highlight. But we definitely are happy that with this conversation we can bring those conversations in with the right people, with the right messages, and ensure that in these scenarios women support women to taking care of themselves. They can help create an environment of lovingness and sisterhood that can ensure that in due course of time we normalize this, and we take an initiative that through Ayurveda, through our ancient wisdoms, and through just basic lifestyle management and changes, as Dr. mentioned about Dincharya, women can take control and proper care of their body. You have very rightly mentioned a point that women definitely are multitaskers, but one task they always forget about is caring about their health. But very important solution to that is that your kitchen itself is your clinic. And as long as you have maintained and managed what you eat, what you consume in regulated quantity, and probably occasional indulgences in greasy foods or in preserved foods, but of course how you manage your food intake and the information you intake, or the lifestyle that you live, the time you sleep, the time you wake up, everything holistically will manage that entire 80% of your health, which is controlled by the hormones. The remaining 20%, of course, we have Dr. Shrilata just a call away.
Anytime.
Thank you so much. So, this was really lovely and very unique perspective that we have seen through. And lovely talking to Radha and Dr. Shrilata. Uh, Signing off from G100, Nurtured by Nature today. See you all next month with something new and unique.